Good afternoon, colleagues. We continue talking about digestion in the intestines, and today we talk about digestion on the enterocytes and absorption. So far, we are talking about digestion in the cavity, starting from mouth cavity all the way towards the duodenum, and influence of pancreatic juice on the food. Today we are talking about what is happening on the brush border, what enzymes are involved there, and they are different from enzymes in the pancreatic juice, in the gastric juice, in saliva, and how different components of food are absorbed. So this is our case for today. A 23-year-old male college student presents to his primary care physician with abdominal pain, bloating, flatulence, and diarrhea after eating ice cream. He denies fever, sick contacts, or recent travel. His father has a history of similar symptoms. The patient is diagnosed with lactose intolerance and is given medications to help him digest dairy products. So we are going to look at how products of carbohydrate, lipid, and protein digestion are absorbed in the small intestines, mechanisms, transporters, sites of absorption, enzymes involved in breakdown as well. So first of all, we are going to look at brush border digestion. So far, we talked about what is happening in the cavity. So here, for comparison, we have a little piece of 2.8 meters long of the small intestine. It's only a small part of the small intestine. And the surface area is here. So how much surface area, if it is just a cylinder without any folds, without any macro and micro villi, so how would the surface area change by these structures that we have here? So the surface area of the small intestines has these circular folds, which are known also as Kerkins folds, and they increase the surface area 3 times. On top of these circular folds, there are also villi, which are protrusions about 1 millimeter length, and here they are. Each of them is made up of cells, enterocytes, and on the surface of each enterocytes, they are invaginations of the membrane now. So the villi increase surface area up to 30 times, and when we combine everything together, including the microvilli, so from the flat cylinder to the surface of each microvilli, the increase of the surface area is 600 and even up to 1,000 times. Guyton actually gives 1,000 times increase in the surface area, which of course makes the surface digestion very, very effective, because in the same piece of the intestines, due to the multiply folding and villi, the surface area is very much increased. What else makes brush border digestion so effective? The fact that enzymes are fixed. So they're fixed on the enterocytes and not floating in the cavity, like for example with many enzymes from the pancreas. Though pancreas plays a central role in digestion because it secretes all enzymes that break down all types of food, multiply proteases, lipase, colipase, and amylase, alpha amylase. Yet they are floating in the cavity, and in case peristalsis increases, they are quickly washed away, and the chance that enzyme meets with the substrate is decreased, of course, as compared to when enzyme is sitting there on the brush border waiting for the substrate to pass by. Right? Another thing that makes brush border digestion, the digestion that takes place here on the microvilli, so important is that it is one site for digestion and absorption. If we are talking about cavity, digestion is in the cavity, and then its transportation of absorbable products all the way to the surface of absorption. But digestion and absorption are coupled. So they are connected, and digestion or breakdown of these particles and absorption are taking place in the same area. Plus, this is a sterile process, which means that bacteria cannot feed on the end products because since enzymes are fixed on the branch border, on the microvilli, the distance between two neighboring microvilli is measured in angstrems, which is 10 in the minus 11 meters, right? So that is smaller than the size of average bacteria. So bacteria cannot feed on the products of breakdown, and that is why the final products of breakdown can be immediately absorbed without any loss. So here we have once again this Kerking folds or valvula conniventous. Then as you see, they have the macrovilli. Here is the villus, one villi, and the crypt. So throughout the surface of the small intestines, there are villi and crypts, and while villi are protrusions of the mucous membrane, the crypts are invaginations. And in the crypts is where the digestive juice is secreted, and mucus also is secreted here by the goblet cells present. They are also, this is also the site of endocrine cell secretion. Yes, please.
You said enzymes are fixed in place. How does this prevent bacteria eating the things?
Because the end products, like for example glucose, fructose, galactose, they go immediately after lactose, maltose are broken by the enzymes that are fixed on the microvilli. The end products immediately go through the enterocyte membrane. And bacteria cannot get through the villi, I mean in between the villi. It's too small.
So after the food is digested, bacteria can't follow it?
No. So the crypts are the place of secretion of intestinal juices and a lot of mucus, and also there are neuroendocrine cells for the regulation, which secrete different hormones and paracrines, and villi are the place of absorption. You can see the structure, and also there are stem cells here in the crypts. And villi is the site of absorption. So this works perfectly together as secretion absorption unit. And inside the villi you can see that there is a very dense network of capillaries and countercurrent system of arteriola and venuli. And in the middle it's a lymphatic vessel, lacteal, to where immediately from the enterocytes, which are lining this protrusion of the mucous membrane, this villi, the products of lipid digestion go immediately into the lymphatic vessel, while products of protein and carbohydrate digestion, so simple saccharides and amino acids, D and triglycerides, they go directly into the bloodstream of the villi. So that's a perfect absorption unit, and crypts are secretion part, so secretion absorption. And we will see later when we talk about diarrhea that in case there is the imbalance between absorption and secretion, either too much secretion, like in Vibrio cholera infection, or too less absorption, there might be diarrhea. There might be too much of watery content that is not absorbed, and this distends the intestines, stimulates peristalsis and causes diarrhea. So when we are talking about absorption, we need to review the mechanisms of absorption that we remember from foundations. So there are major three, that is active transport, And active transport, as we remember, always requires what? Energy. And transporter, right? So primary, active may be primary and secondary, and in most cases secondary is sodium dependent, but we will see that sometimes it is hydrogen dependent. But in any case, in most cases it's sodium dependent, which means that it depends on the activity of sodium-potassium pump for the creation of constant gradient. And this secondary active may be co- and counter transport, and we will see that for amino acids, D and tripeptides, they are both co- and counter transporters used to transport through apical co-transporters and through basilar membrane counter transporters. Also diffusion. Diffusion is a form of simple transport. Sorry, passive transport. It's the form of passive transport, which means that it does not require energy. But diffusion can be simple and facilitated requires what? Protein. Transporter. Requires transporter. Even though no energy may be required, but it requires transporter. What does it mean? If transporter is required, it means that the process can be saturated, right? So there is a limit to the speed of transport. If we are dealing with transporters can be saturated. So the rate of this facilitated diffusion can be limited by the availability of transporters. And finally, endocytosis. It's not so much important for adults, except for B12 absorption in ileum, but mainly present in babies, where it is important for absorption of immune globulin G. Sites of absorption. The major site of absorption and digestion and absorption is small intestines, especially duodenum and jejunum. Stomach is not the major site of absorption, and pretty much nothing except for ethanol and some drugs, especially NSAIDs, are absorbed in the stomach, which, as we remember, are damaging for the mucous membrane of the stomach. They destroy protective layer of bicarbonate and mucus, and this is very unfortunate that these substances are absorbed in the stomach, but nevertheless they are absorbed. Ileum is important to remember as the site of absorption of B12 and bile salts. So bile salts are largely recirculating as a pool. It's only a small percentage of it that is usually synthesized de novo. Of course, if a patient has ileum resection, then a lot of bile salts have to be resynthesized.
What are bile salts? Bile salts? What are they? Like bile salts, what are they?
Where are they?
What are they? What?
They are cholic, deoxycholic, so they're different bile salts which are secreted by bile.
So, like, what?
They're secreted by hepatocytes.
So it's bile juice? Like it's the juice? Or?
They are component of bile. Mm-hmm. Yes, please.
Is there any digestion in the colon, or is the absorption moving?
There is no digestion in the colon.
So it ends in the small intestine, it's done.
Pretty much yes. So colon is just moving, and even with regards to absorption of water, colon absorbs some water, but it's not the major site of water absorption. And that is a common mistake. Actually, many people think that since the colon is involved already in forming the fecal masses and everything is already becomes dry there, so that must be the major site of water absorption. No, it's not. Because colon has these tight gap junctions, and it really is minimal on reabsorption. It does reabsorb some water and electrolytes, but minimally. So we will start with carbohydrates and talk about the digestion of all the components of food. So about 40, even up to 60% of our daily diet is carbohydrates. mainly in the form of complex saccharides and mostly in the form of starches. Starches digestion starts right in the mouth cavity. And here in saliva there's alpha amylase or ptyalin, it's another name for the same enzyme, that breaks down starches. So that if you put a piece of white bread which is rich in starches, even unsweetened bread, and keep it in the mouth for 30 seconds, 1 minute about that, even without chewing, let the saliva soak it, you will very soon feel that it is sweet in your mouth, because this means the breakdown of starch. And disaccharides and trisaccharides are released from starch, and they give this sweet taste. Of course, the major work is done in the duodenum by alpha amylase coming from the pancreatic juice. So starches are broken down to D and trisaccharides, which are maltose, lactose, and sucrose. These are not absorbable forms. Remember the patient who was diagnosed with lactose intolerance? So lactose is a milk sugar, the milk saccharide, and it is present in all the dairy products. So after eating ice cream, the patient felt unwell. His stomach was distended, his abdomen was distended, he felt flatulence, bloating, and eventually developed diarrhea. Because in the absence of enzyme lactase, which breaks lactose, lactose cannot be absorbed by itself. And if it is not absorbed, it stays in the cavity of the intestines, it attracts water, being high molecular substance, and it causes bloating and eventually diarrhea as the intestines are distended, peristalsis is stimulated, and this causes diarrhea. So the only absorbable forms are simple saccharides, which are just three: glucose, fructose, and galactose. So only these three can be absorbed, the rest can't. So which means that all the starches, all the complex saccharides that we get with food have to be broken down to these three simple saccharides, which only can be absorbed. And this digestion, which is initiated in the mouth cavity by ptyalin, continues in the duodenum by alpha amylase from pancreas, is then continues on the brush border, because the enzymes that can break lactose, sucrose, and maltose are only present on the brush border. So pancreatic amylase digests only 2 disaccharides. It cannot break disaccharides. Disaccharides are broken down on the brush border to form monosaccharides, absorbable forms. So we need these 3 enzymes to be present and functional on the brush border. The patient who has the genetic disorder in lactose intolerance had a deficit in enzyme lactase. So it's a genetic disorder. His father had similar symptoms. So when enzyme lactase is not present, patients cannot take lactose-rich products, so they cannot digest milk products. They cannot digest the sugar in the milk products. So how is absorption of carbohydrates going? I'm testing you on that, and you will see it on the practice questions. So it's different transporters and different forms of transport. Glucose and galactose are crossing the apical membrane. This is the lumen of the intestines, and this is the blood. So this is the apical membrane, and this is the basilar membrane. So across the apical membrane, glucose and galactose are transported in the same way by means of secondary active co-transport. This secondary active co-transport is sodium dependent, so they use one and the same transporter as GLUT1. So glucose and galactose, they compete for the transporter because they use one and the same. Fructose uses facilitated diffusion. So fructose does not require energy, it's diffusion that fructose gets into the enterocyte with but it uses transporter, GLUT5. GLUT5 is transporter that is used by fructose only, while glucose galactose also use facilitated diffusion to cross the basilar membrane. They use this time different transporter. And you can see that on the basilar membrane, the transporter that is present is GLUT2, not GLUT5. So GLUT5 is only on the apical membrane, GLUT2 on the basilar membrane, and GLUT2 is used by all these three monosaccharides. I want to take a 1 minute break and let you draw without looking this the cell enterocyte and the mechanisms of transport of these three monosaccharides, glucose, fructose, and galactose, through the apical and through the basilar membrane. What is the mechanism, which is energy free, which requires energy, what are the names of transporters? I just practice drawing so that you remember, make this a nice picture to remember.
Is it graded?
Do we have any assignments graded in the professional schools? I don't think so.
Doctor, say like, I don't remember all the ones that we took in FND, the foundation. Should I go back to that lecture and like review the different types of transporters and what you call them?
Yes, because I use the same example in foundations.
So the same are used here as well.
Hmm?
The same examples are used here as well.
Yes, if you go back to the lecture, you will see them.
Right here. And right on t-shirts.
Is it this one?
If you are done, please exchange the drawings with your neighbors. Show it to your neighbor.
This is correct, and it goes in.
Yes, it's a pump. Yes,
So that
sodium.
goes out the basically.
Sodium. Oh wait, no. Three sodium out. Because sodium gets in. You need sodium to get. So it has to go out. Sodium is mostly outside passages inside.
So how does it go like out
I
here?
did not see that. Here it was
Like it goes out here.
and then
so when I
glucose,
get-
yeah, I put sodium and glucose.
Sodium is pumped outside cell.
Okay.
Because
I mean,
its concentration is normally higher in here than in ICU.
Anyways,
Oh,
So
okay.
sodium has a
Oh,
tendency to get in, so you need to maintain this hydrating, you need to continuously pump sodium out
If you make it,
and pump sodium.
if you make it high here, it's gonna come also high here.
Thank you for
I labeled this A, SG, and Na plus as well as galactose or glucose. This is purely fructose, which is GLUT5. This is all three, and then C, which is galactose, fructose, glucose, and this is normal Na plus.
That's good.
And is the same?
Yes.
The
And energy is needed for this one only.
For this one only.
And this is facilitated.
This is facilitated. This uses the energy here.
Secondary.
Secondary. Yes, thank you. Now,
aren't aren't LUT2 receptors usually found on the pancreas?
what is
LUT2 receptors are usually found in the pancreas and the liver, especially pancreatic beta cells. But how are they expressed in this cell? I'm not sure which cell this is. Epithelia cell size.
It's a transporter to pass into the blood, and then from the blood it goes into the pancreas, and entry of glucose into the Langerhans cells, beta cells actually stimulates the release of insulin. So yeah. Question. While you're looking at your drawings, which transport of which saccharides will be blocked if we block sodium potassium pump?
Galactose and glucose.
Mhm.
That's GLT1.
Yes. Cross the apical or cross the basal? Both, right? Since it is not getting through across the basilar, there would be nothing to absorb. I mean, since it is not getting across the apical membrane into the enterocyte, there would be nothing to absorb. All right. So, lactose intolerance. Yes, please. The question? Yes, sir. If we block sodium-potassium pump, sodium-potassium pump works on the basolateral surfaces of the membrane to create and continuously maintain a high sodium gradient directed inside the cell. So what the pump does, it pumps 3 sodium out in exchange for 2 potassium in. So when sodium is coming inside the cell by the gradient, sodium-potassium pump makes sure that concentration of sodium remains high in ECF. So it pumps 3 sodium out in exchange for 2 potassium in. And because the sodium concentration is high in ECF, it goes by its concentrational gradient with S-GLUT1 transporter inside the cell. No energy is required here by this transporter because the sodium gradient is already created. And this same transporter, S-GLUT1, simply drags inside glucose and galactose following sodium gradient. So in our patient who has lactose intolerance, it's a genetic defect in enzyme lactase present on enterocytes. So there's nothing wrong with pancreatic secretions. Pancreatic enzymes are absolutely okay, all right? So that you understand that alpha amylase is secreted normally in normal amounts. There is no deficit in pancreatic amylase or any other enzyme. It's lactase deficiency only. Patient has no problem breaking down maltose because maltose or sucrose because the maltase and sucrase are not affected. But this sugar that is present in the milk and all the dairy products cannot be digested. So lactose accumulates there. It's highly molecular substance, so it creates osmotic gradient which attracts water into the intestines. Water and fluid on the whole distends the intestines, causing the distended abdomen in the patient, flatulence, bloating, and eventually diarrhea. When luminal distension is produced by fluid accumulation, it enhances peristalsis, causes diarrhea. Also, lactose that stays there is fermented by the bacteria that are present in the intestines. And when bacteria ferment lactose, they produce a lot of hydrogen. Hydrogen, being the gas, can get into the can cross the membranes easily, because we remember that membranes are lipid bilayers and can be easily crossed by gases. So it can be absorbed in the blood and actually can be exhaled. So that is why, to confirm the diagnosis, we do hydrogen lactose breath test when patients are exhaling a lot of hydrogen, which was produced by bacteria in the intestines as they ferment the indigestible lactose. It's important to say that if in these patients we make the biopsy of the intestines, we would not find any damage to the microvilli or to the brush border, to the enterocytes. They are absolutely intact. They are not damaged, and absorption here is not happening because of indigestion to the absorbable products. There is no digestion to absorbable products. But if these patients are given enzyme, synthetic enzyme, lactase, they can digest it. And this same lactose will not cause diarrhea anymore if you give them enzyme, because there is no actual damage to the histological bigger structures. Yes, please.
The cause of halitosis, is it the H2 gas or the, for example, methane, or is it sulfur related?
It can be both.
All three?
It can be, no, normally it's hydrogen or methane.
You said when it stays lactose is not broken down, it stays and bacteria ferments and produces H+. Why doesn't the H+ cause ulcers?
No, not H plus H2 gas.
H2 gas.
Yes, it's not hydrogen ion, it's a gas.
Okay.
So in case of lactose intolerance, we are talking about osmotic type of diarrhea. We will be talking about 4 major types of diarrhea later in the lecture. So the easy way to treat these patients is to avoid to make them aware that they cannot digest lactose, so they shouldn't be eating lactose. And nowadays there are a lot of lactose-free dairy products. There is ice cream which is lactose-free, so there is no need to eat milk sugars if they cannot digest them. Or another option is to give enzymes, which is in case they have accidentally taken the product which is not lactose-free. But it's basically diet adjustment. Protein digestion. So protein digestion occurs at 3 different locations. First of all, of course, as we remember, it starts in the lumen. And the first site where proteins are exposed to proteases is stomach. Stomach, though, is not the major site of digestion, as we all remember, but initial digestion of proteins starts here. It starts with even denaturation of proteins by the hydrochloric acid in the gastric juice, and then it continues with proteases of the gastric juice to polypeptides. But the major role in digestion is played by pancreatic proteases. Pancreatic proteases are many. The major difference in the proteases in the gastric juice, well, they all do the same thing, break into polypeptides, but they active within different range of pH. So the range of pH within which gastric proteases are different is different from 1.5 to all the way down to 6 and 6.5 for chemazine or renin. But in pancreatic juice, all the proteases are active within same narrow range of pH between 7.4, 7.6 to 8.4 approximately. So that is relatively narrow as compared to stomach. But the difference in proteases, and there are so many here because they do different jobs. So they are endopeptidases and exopeptidases. So endopeptidases, they break the inner peptide bonds in the polypeptide molecule, while the exopeptidases, they can break the molecule either from amino end or carboxy end. So that's why they are called exopeptidases, are called aminopeptidases or carboxypeptidases, depending on from which end they break the peptide bonds. So as a result, there are amino acids and D-tripeptides that are formed. On the branch border, there are oligo and dipeptidases, which are breaking the polypeptides to dipeptidases and tripeptidases and amino acids. And in the mucosal cells, there are also D and tripeptidases. Peptide absorptions. absorption. So peptides are the products of protein breakdown are absorbed in the form of D and 3 peptides and amino acids. Little amount is absorbed in the form of small peptides as transcytosis or endocytosis. So that's not the major form of absorption, but some are really absorbed as transcytosis. So you can see that DN3 peptides and amino acids use secondary active transport, either sodium or hydrogen dependent, and they use both co-transport and counter-transport. So DN3 peptides use hydrogen dependent transporters, and its co-transport cross the apical membrane from the lumen of the intestines, and counter-transport from the cross the basilar membrane into the blood, so that hydrogen could return back and be reused. Yes, please.
What does basolateral mean? Basolateral.
So the membranes of the cells are called apical, lateral, and basal. Basolateral means both lateral and basal, basically. For example, we see that sodium-potassium pump and other transporters, they are located not just on basilar membrane but also on the lateral. So when we say apical, it's directed into the cavity. You probably came across this in the renal physiology when you were talking about absorption secretion. There we also see apical surface that is facing the lumen and basilar facing the blood vessels, blood side, so going into the ECF and blood. Amino acids are transported with sodium co-transporter across the apical membrane and counter-transporter across the basilar membrane. So as you understand, there are pumps initially that create this gradient for both hydrogen and sodium. All right. Let's again take another minute and draw the scheme showing absorption of D3 peptides and amino acids.
This right?
DN3 peptide, co-transport and counter-transport. Co-transport, counter. Yes, that is good.
After you said that when the lactose is stuck, it grabs water, so it
Because it's
stands,
highly
and
molecular.
processes diarrhea. Well, what does the H2 gas do?
H2 is produced as bacteria ferment the
So
lactose.
when the bacteria ferments the lactose, doesn't the lactose go away? Like how does it still bring water with it? Like how is drinking water related to the bacteria fermenting? Like what is the
It's
bacteria?
not related.
What does the
There are
bacteria do?
there are two parallel processes.
What does the bacteria
They are
do?
eating lactose. In
So-
simple, that's
Yeah, so
they're
when,
fermenting it, right?
when it's eating it, how is it still bringing water with it? Is it gonna still bring water? Either way.
Yes, because as it is fermented, that's it works like an yeast, which ferments everything, and gas is produced, and we add flour, and we can make nice bread. It's pretty much the same thing.
So as lactose is like not broken and it's getting
It's not broken, but it's as fermentation starts, it's still not broken, because you have to remember that absorbable forms are only monosaccharides. Bacteria, though they do break to some extent and they cause the fermentation,
why is
they
it-
cannot break to monosaccharides.
Why is it bad if bacteria breaks it? Like at the end it's gonna be broken, so it's good. How is it bad?
It's not break to the absorbable forms.
So,
So whether they do ferment, but it does not lead to absorption
So it will
of
leave to
saccharides.
be excreted.
Yes.
So even the broken parts are gonna stay with it. It's not gonna go like the bacteria
Right,
ferments.
right. They cannot go because only fructose, glucose, and galactose can be absorbed. And for this, you don't need bacteria. You need lactase.
And if we don't absorb lactase, is it bad because we're wasting it, or it's gonna affect us, like harm us?
Lactase is not. I mean, it is used, of course, because anyway the cells are shredded enterocytes. But it's enzyme that is present on the enterocytes, so it's not lost much in the process of.
So while it's being fermented, it's gonna bring water. So fermentation and bringing water same time.
Yes,
And,
they are parallel process.
You said there's enzymes on the border. Are they pancreatic enzymes or the?
No, they are produced by enterocytes.
These enzymes, lactase and these stuff are on the border that don't allow bacteria to come.
They are enterocyte-produced enzymes.
And they don't allow bacteria to come and eat the food that's getting digested.
It's like the spaces between the microvilli, very small.
Yeah.
It's not because enzymes are like covering the space. It's the
No, they're not covering it. They are fixed on the microvilli, but bacteria can because
Microvilli is small
because
space.
of tight connection or tight coupling because between digestion and absorption, you can only absorb these monosaccharides, which are only produced after the digestion, and digestion is on the microvilli. So immediately after we receive
They go
glucose,
inside.
they go inside.
Bacteria
So
can't
bacteria
follow.
has to come in between the microvilli to be able to feed on them
It can't.
before they are absorbed.
It can't
They
because of the
can't.
space. And the enzymes are on top of the microvilli.
All right. And they can only ferment it, but
So how do you produce a gradient here? You see how this goes in and this goes in?
yes, no, it's out. It's counter. This is core and this is counter.
Yeah, but NA goes in here and then NA also goes in here, right?
Yes, but it's a pump that pumps everything out.
Where do we pump it out?
So on the basolateral membranes.
Oh, here?
It's always there, yes. We do not draw it here. Well, actually, yes, we have to draw the pump, but it's always there. Every cell has it.
So is the basolateral knee like here?
It's here and here.
Oh, so if it's present on both lateral
On
and
both.
basal, we call it basolateral.
Yes.
So that's in
glycine and taurine.
Yes.
Taurine.
Some cells mostly basilar membrane, some have also the lateral sides.
It's in
Is it
secondary.
what we call basolateral?
Secondary.
Alright, so if you're done, also add to your picture sodium potassium pump, because this would be the one that creates the gradient for sodium constantly, right?
There should be a shunt here, right, for H plus?
Yes.
Shunt outside.
Yes, the pump.
That's
Hydrogen potassium, yeah.
no energy needed, just goes because of the
Right.
concept.
No, the pump uses the energy.
It's a shunt or a pump?
It's a pump.
Medical school.
Alright, so we will continue. Any questions so far? Is it clear?
Can you please go to that previous slide? I have research as well. So in both ends, whether it was the apical or the basolateral, we have H plus into the second. How does that happen? Like, doesn't the gradient affect that, or how does H plus go out of the second?
Just a separate
By the pump.
So there are pumps that pump H plus out after.
Yeah.
Okay.
So and when we are talking about these transporters, you have to for amino acids. You have to remember that amino acids are divided into three major categories: neutral, acidic, alkaline. So each of these three classes uses a separate transporter. So there are many different transporters for amino acids, though the principle of transport is the same. Lipid digestion and absorption. So most dietary lipids, and it's about 30% of the total food that we consume comes in the form of lipids. So most dietary lipids is neutral fat or triglycerides. And in order to break down fat, you have to understand that fat appears in the water phase. So fat appears in the water, in the fluid, pretty much in the digestive in the cavity of gastrointestinal tract. So in the intestines, it's pretty much fluid, and fat sits there as a big droplet. In order for enzymes to be effective on breaking down fat, the first step is breaking this big droplet of fat into smaller droplets. So the big globule into smaller droplets, so that we could increase the surface area. So the process is called emulsification. When the fat, which is not really dissolvable in water, is forming fine emulsion, and this very much several times, even dozens of times, increases the surface area for the enzymes to break down fat. So this emulsification of fat that is happening immediately in the cavity of the duodenum is done by bile salts and lecithin. So lecithin, bile salts, and isolecithin, they are components of bile. They are major components of bile. So both lecithin and bile salts, they have they are amphoteric. They have both hydrophobic and hydrophilic portions. So that's why they surround the fat in such a way that they are hydrophobic parts surface fat and hydrophilic part surface water phase. And this allows the breakdown. So bile salts are important for the process of emulsification of the fat. We will see that bile salts do not this, but this is the first and important step in fat digestion, turning the big droplets of fat into fine emulsion, increasing surface area for the lipases to act on. Yes, please.
So is emulsion the process of just breaking down the fat?
Yes, into droplets. It does not involve enzymes. It's not enzymatic breakdown. It's it just increasing the surface area. That's what it does. Because if you put drop oil in the water, one big drop of oil would stay in the water as one drop, right? And it's the surface area, the area of interaction of this oil drop with water phase would be minimal. Because of high molecular tension in between the oil, which is a lot dense than water, right? So to make lipases more effective on fat, you want to increase the surface area. So bile salts work pretty much as detergent to increase the surface area, to emulsify the fat and expose it more to the further action of lipase.
So is this like the same process as like making mayo, for example?
Making what?
Mayonnaise? You emulsify it.
It is.
Yes,
Yeah.
yes, but you beat it, yeah.
If you want.
Okay. But it's not quite because water is not component of mayonnaise. But you are right in terms of mixing the oil, yes. But I would rather compare it to the detergent, the thing that is done by the detergents, like when we want to, wash it, we want to break it into small emulsion. So bile salts are important. And for bile salts, as you remember, to act, Dr. Abdul-Jabbar Russell will lecture you on that, but bile salts have to be in ionized form to be able to do the job of emulsification. And this ionization is only possible within a certain pH range. So they are released from the gallbladder into the duodenum, and over their pH that is slightly alkaline allows them to be ionized and do their job, initial job of emulsification, which is preparation of fat for lipase action. Okay. So next step is enzymatic digestion. So once the fat is fully exposed and the surface area is increased as much as possible, now lipases can be more effective on breaking down the fat. to monoglycerides and fatty acids. And as they are entering the cells, for the products of fat digestion, there are no transporters, special transporters required for them to cross the membrane of the cell. Why?
Lipophilic.
Yes, because they are lipophilic. And we know that all the membranes are made up of lipid bilayer and proteins embedded into a lipid bilayer. So which means that lipids and everything that is easily dissolvable in lipids, which are all the gases, nitric oxide, hydrogen, carbon dioxide, oxygen, they can easily cross. Steroid hormones, alcohol, and of course lipids themselves. So monoglycerides and fatty acids, they do not need transporters to get across the apical membrane, but they do need transporters to carry them through the water phase all the way down towards the apical surface of the enterocyte. And these transporters are special structures known as micelles. So once they get inside the cell, there is reconstruction of triglycerides and formation of chylomicrons, which are absorbable forms into lymphatic system. I will stop here and we will continue next class.